Welcome back to the Curious Neuron podcast, everyone. I am joined by two very special guests, Nathalie and Dr. Tina Montreuil. Welcome to the podcast. Nathalie, it's your first time, and I'm excited to share your journey with everyone. And Dr. Montreuil, you had been here before. We spoke about emotion regulation skills. Today, we're focusing on mental health in the postpartum period. I'd love for you to share a little bit more about the research that you've been doing and what led us to this conversation.
Yes. Thank you again for having me, Cindy. It's really a pleasure to be returning. So similar as to what we were doing in the past, the idea of right now working in pregnancy, it's still to better equip parents, make them feel that they're capable of facing this transition to parenthood, either for the first time or in some cases multiple times. But essentially what we're really focusing on right now is the idea of not simply providing these types of tools to parents once they are parents and they are experiencing challenges, parenting challenges with their children, but sort of a more of a preventive approach is to actually address some potential, parenting challenges, but mostly addressing parental needs during pregnancy and using, I guess, the motivation that we have during pregnancy for self-improvement and preparation that often accompanies the prenatal care phase, is basically using that motivational aspect to really equip parents, promote their well-being. And I guess the sort of the theoretical framework, to add a big word, but essentially we're basing ourselves on a very sort of well-known model, which is, parents that are doing well socially and emotionally and psychologically will most likely be in a better position to offer parenting, sound parenting, more adaptive parenting to children. So that's the only difference. We're doing the same exact thing, supporting parents, but supporting them during pregnancy in preparation for parenthood.
Time and time again, when I speak to parents, this is exactly what they talk about, where the sort of gap is, where they feel like they're sent home with this brand new little human in their arms, and they feel equipped in the sense of, well, they've learned how, or they're ready to change diapers or figure out what to do when it comes to sleep, but they don't feel equipped when it comes to their own mental health and their own needs. And sometimes it only hits us a little bit later, right? Where, I thought I had the tools, but I don't have the tools. Yeah. And I'm so happy that we're going to have this conversation. And this is what led to us bringing up Nathalie, where we really wanted to share somebody's journey. And I think that's what's missing sometimes. Nathalie, welcome. And I would love for you to share your journey, how you came, into contact and connection with Dr. Montreuil, and maybe a little bit of your postpartum journey.
Well, thank you for having me. So I'm a mom of a 2-year-old little girl. I had a good pregnancy, so I have nothing to say about this. And I did suffer from depression last fall. So I was back to work, and I started to feel some symptoms that I was not myself, and I didn't like it. And it led to even at a leave of absence, because my mental and physical health really, I had like a breakdown. And it's been really, really tough, the return to work. And in fall, so looking for some resource, help, or anything, I kind of just dropped on Tina's work on the web, and I already told Tina, I already thanked her, because I was finding that someone is doing work, someone doing research on that, and so important, and gave me hope that someday prevention will be there. Someday parents might not live what I have lived. And that's how I connect with her. They were asking for some messages or testimony of people, of mom and dad living it. And so I reached out to them, not knowing if I would really receive an answer, but they did. And we connect like this. And I felt understood. I felt listened. And for once I felt that, okay, there is someone who understands what I'm living.
Right.
And it's going to use it's going to be using what I'm living right now to maybe have better tools in the future. So that's how I connect with Tina. So thank you again, Tina, for working on this. It's so important, really.
Thank you so much. And I think, I would say reciprocally, it's so critical to have people like you that are so inspiring, and Nathalie, to be able to inform our work as well.
Well, thank you.
The parents that are listening, I know that something has stood out to them. You mentioned last fall and that your child is 2. I think when a lot of parents think of the postpartum period and postpartum depression or anxiety, that it happens soon after we have that child. But you're talking about a year or more later, right? When you started seeing symptoms?
Yes, I went back to work after 30 months of mat leave. So before that, I didn't. Of course, I had ups and downs like everybody else. The body and the mind is changing. So, of course, there were days that I didn't feel myself. But the next day, or just looking at my baby smiling, and I was feeling better. But it was really when I got back to work that I had symptoms. And I think one of the things is that I realized how much maternity and parenting changes us. And I didn't expect that at work also. It was like a bit frustrating that, oh my God, okay, even at work I'm not the same person, so I didn't like that. And more of this, I had really real symptoms of depression that I knew it was symptoms of that. So yes, it's not, it's not right after giving birth. It can be later. And I knew about it. I heard about it before. I just didn't expect that I was into that. And when I tried to talk about it, I was not afraid of just saying, I don't feel myself. I don't know what to do. People just answered, oh, you'll see, it's normal. This is parenting. This is, having a child is tough, but it'll pass. Hold on. I'm like, okay, it's normal. I'll wait.
Exactly.
Yeah.
And that's the word we need to focus on, right? So many parents, whether it's your first, your second, or your third, sometimes we have these emotions, and it's really hard. I've spoken to some parents who look up the symptoms online to know, like, am I perhaps experiencing postpartum depression or anxiety? But then when they read them, they're not even sure at that point. They're like, well, sometimes, maybe, I'm not sure. And they speak to parents or, other parents or friends in their community, and they're told, it's normal. I went through that. And then nothing happens. So this is something that we wanted to also make sure we highlight, where we're trying to normalize, certain mental health symptoms, but are we actually turning it into something that's not allowing somebody to get the help that they need, right? Dr. Montreuil, what do you see on your end, when it comes to clients or the research? Normalizing, I know it's coming from a good place. Like, we're trying to make people feel like, well, we all experience these symptoms of anxiety. I went through this as well after my first, but then at what point do we need to take action as a parent or speak to someone?
Yeah, so I think it's so critical, and that's what really inspired me from what Nathalie was saying. She's like, I recognize it. I wasn't quite sure, but I knew I had to speak about it. And I think that's the thing. Like, we have to really, I guess for people like Nathalie, she was upfront, she came, she discussed, she reached out. For other people, that's not their experience. For them, like, we need to almost create a safe space around, mental health issues more generally, but especially create a space, and I think this is our responsibility as clinicians and researchers, to really create a space where perhaps we are facilitating this dialogue on mental health issue or just psychological distress if the mental health piece is ostracizing or stigmatizing. I think one of the things that is noticeable is that we know literature, we see it, there's the visual, like, that all the physical aspect of pregnancy that is visible, our body changes, but that's just the tip of the iceberg. During pregnancy, there are neuroanatomical changes, and I feel we often talk about those neuroanatomical changes, those hormonal changes, in a way that promotes nurturing, and that's true, like attunement to our baby. So we really sort of depict it on an evolutionary basis, why those are are good. But what if for some people, those changes actually trigger some changes in terms of, endocrine changes, hormonal changes that actually, maybe suppress the, serotonin,
Right.
release and secretion, where that would impede on our sentiment or impression of being happy and content, and combine that with the environmental changes, the true hardship of, what comes with sleep deprivation and,
Mm-hmm.
not knowing what is the best course of action. And so I would even say, add to that, if your experience of parenting, you receiving the parenting was not a positive one,
Mm-hmm.
you come with those sort of standards of, or fears, I should say, about, sort of predisposing factor about how yourself, perhaps, as a
Right.
parent and your parenting approaches will be compromised. So I think one of the things that I want to highlight is this issue of needing to create a space. Because currently what's happening is that, I highlighted some of the changes that happen. And there's almost this notion that once you give birth to that baby, basically your body goes back to reset pre-pregnancy. But I think that has to be questioned. Maybe for some that's the case, but I think many experts would argue that some of those changes are permanent for some. And so therefore that means that perhaps, even at the health level, it's going to cause lifelong changes in the woman's health. And then there's that one thing about, the aspect of permanent changes as a result of pregnancy or not. And then there's the other piece that, once your baby is born, the care is turned towards the baby. The baby will have periodic appointments postnatally. And what I've heard a lot from women and birthing people is that essentially, what happens to me? Where is my space? And then there's sort of that social expectation that if I were to say that I'm not well, or sort of claim that maternal or that sort of parental space, that it might actually be maybe an indicator that I'm not really caring as much for my baby as others. So there's almost that stigma, not just around mental health issues or psychological distress, but also perhaps stigma around I'm wanting space when really now I'm a mom and it should all be about my baby. So I think we have to question, and Nathalie is the one that actually inspired us to think that way. We prepare so much for the prenatal phase of the child, the mother as a receptacle of this living being that is being formed. And then once we give birth, there's not really a systemic plan nor a medical plan in place to really care for the mom and her health. And her capacity, as I was going back to the introduction, to parent. So this whole aspect of parental well-being, maternal well-being, in order to be able to ensure the sustained well-being of that child as we're facing these parenting challenges.
I know that so many parents feel seen with what you just said, and feel like this needs to happen sooner than later, that sort of support for the parents. Is it like that across all cultures? I just had this idea pop into my mind because I know that I've spoken to some people in Northern Europe or other countries that feel that either it's a cultural thing where there's more of that family support once you have a child and the family sort of comes together to support that new parent, new mom. And then after I've heard some people talk about like not a doula, but some sort of person that comes with you and stays with you that's part of the healthcare system, so that the mom has somebody there to do the laundry. It's not a family member, it's truly part of the healthcare system. So are we lagging behind here in North America?
So definitely a lot of the models of care, of prenatal care and postpartum care, if we look at models that have, like I would say models that have a lot of guidelines in place in terms of postpartum care, that align with the World Health Organization's recommendations, which is, to have between 3 to 6 visits postnatally as a minimum, right? Which is, in essence, that's really not what's taking place in North America. But countries like Australia, countries like the UK, where again the midwifery takes or has a good portion of the care of mother and child during pregnancy, but also postpartum, it's clear in our experience working with midwives in the Montreal area and also our connections across Canada, that the type of care, the framework in which midwifery is exercised. When I was talking before about creating a space for dialogue, for sort of almost like empathy, a working relationship, caters more to that sort of postpartum or right. I would say ideal postpartum care. It doesn't mean that in, let's say, our first care or in the medical system that we wouldn't be able to do that, but it would require some sort of a shift. And in the care providers' defense, we work very closely with them as well. I think a lot of them, nurses, physicians, they have a desire to service women postpartum. But I think what's really lacking is perhaps the knowledge, the mental health piece. Like, how do we assess? How do we assess in a way that's not going to be confrontational, or it's not going to be, for example, or it's going to be culturally adapted, since we're on that question, right? So I think we also have to ask ourselves the question, like, what else could be done in this space to actually, provide that care for women like myself, like you, like Nathalie, in order to ensure that ultimately, we're going to be better prepared not only for conception, but for the job of being a parent. So that's the whole debate there.
Right. That word better prepared, Nathalie, you mentioned this before, where you just felt like you needed those tools. Looking back now and knowing what you know now because of the work that you've been doing with Dr. Montreuil, what needs to change for new moms and new parents? What would you have needed in that time?
Well, first, yes, try to avoid that thinking that once you give birth, the body and the mom just goes back to what she was before, and just ignore her. It's really, it's fascinating, that when someone gives birth and you ask, how's the baby? Yeah, how's the mom?
Yeah.
How's the dad?
What about me?
You just forget it, but it continues after. So that shocked me. So if we could stop, ignoring the parents and stop just focusing on the baby. And also if there were, and I don't think I can really say what exactly needs to be done, but just provide space where the parents could ask themselves, am I okay? Or someone just ask them, are you okay? Because I was not led to ask myself during, and I said, my depression started at work. Maybe it started before, but I just don't know it. My symptoms started because I was at work. But maybe it was before. I just didn't ask myself. And I just don't even know how it's not something that we ask ourselves daily. Am I doing okay today? No. So, and I still don't understand how come every month I was going to see a doctor or a nurse to see if my baby's okay. No one ever asked me. No one ever looked me in the eyes like, are you okay? Physically, mentally? Just a simple question that could have made the difference.
Yeah.
And just think about people who are isolated. I'm not. I was doing my boyfriend, my family, my friends. Just think about people who don't have access to those doctors and nurse, or don't have access to families and are isolated. They less think about asking themselves, am I doing okay? So just that space of the thinking of, am I doing okay?
Right.
It's not existing.
Right. And you were also proactive in yourself, right? Where you started doing the research, and not everybody might think about doing that, or some people might retreat and go back a little bit and just kind of isolate themselves a little bit more. And like you said, when we were talking last time, we also brought up accessibility versus availability. And I think we need to bring that up because with what you just said, right? If somebody was in a different area here of the province that didn't have access to Dr. Montreuil's work or was close to the university, would they have been able to do and get the work that you, or the help that you got?
Probably not.
Right.
And And even for myself, like, I asked myself, it was too late. I was already in depression. What if I would have had some resources or help just before getting to that point that I would have symptoms? But I didn't, because I didn't ask myself. I didn't have any resource or any books about it. So the resources exist because I found it out in the fall when I was in it, and that's how I connect with Tina. So it's not because they don't exist. The accessibility is there. It's just it might not be at the right moment. And that's the proactive way that I don't feel that I've been that proactive, knowing that it led to a leave of absence. At least I might have been a bit proactive, so I didn't. I left for just 2 months. I didn't leave for a whole year, so might have been a little bit proactive, but I don't feel I've been that much.
Yeah, I get that. You know, we talked about the normalization piece of, people telling, us that it's normal and these symptoms happen to everybody. I've spoken to some moms who felt some rage out of nowhere during the postpartum period and felt so embarrassed and shamed, not only in their relationship of this rage coming out of nowhere, but they didn't want to talk to people about it. There are so many different symptoms that people might isolate or not want to talk about, even self-harm or harming their child too. People would not want to. There's some moms who shared with me that, they don't want anything to happen like with social services, like if you say that you had these intrusive thoughts. Dr. Montreuil, is this common? Like, because a lot of these symptoms might feel embarrassing or shameful to a parent, or they have guilt around it. What would you recommend or suggest to that person who's listening and has these thoughts, and because of those thoughts, they're not sharing what they're really feeling with the people around them?
Yeah, absolutely. So you're very true, and this is an experience I've had as well. Both, conducting either mixed methods of qualitative, like interviews where we connect with people like Nathalie and others who have experienced either just more generally mental health distress or psychological distress, or specifically surrounding the perinatal and transition to parenthood. So it's very frightening because for a lot of people, like I said, for some people, it's just the anticipation that because, I was sort of on the receiving end of poor parenting, that perhaps all these sort of beliefs about, the fact that I'll be limited myself if I didn't get a good parenting, then probably I'll replicate the same thing. And I know for some parents, just that thought of replicating this sort of intergenerational deprivation or maladaptive parenting is very distressful. And then there's just combined with that where, like we are often, I was doing a presentation yesterday and, kind of showing the image of like a lot of the times on, this will be on social media and this is the good side of social media, but sometimes social media projects an unrealistic expectation. I was talking about attunement before, like the mom that is smiling and sort of like cuddling and sort of like, lifting the baby as if, it's this marvel. And certainly parenthood is filled with those moments. But for a lot of parents, it's being, there was another picture that I was displaying of a mother, sort of lying on her back with the baby crying next to her and sort of being overwhelmed and not knowing how to deal with this. And probably in that very moment, if I were to put thoughts in that person's mind, it's like, I can't handle this. I'm going to basically, mark or, affect my child's well-being forever. Yes. And the same goes for fathers. Let's not forget them, right? Like the notion that, maybe in this case, it's also, I can't support my partner. I can't provide the assistance. And a lot of times, like just to throw in a little word there for our fathers there, is that a lot of the times they haven't had like the experience of parenthood, or I should say the experience of pregnancy for them is very external. They're not experiencing these sort of biological and biophysiological changes that somehow kind of get us as mothers or as birthing people to kind of get prepared for the reality of this transition, whereas their fathers, a lot of the times being more on the outside of this, they almost, we're talking about beliefs, they can maybe tell themselves that they don't get their partners, that, they're not equipped for this. And then, so therefore, I think, what we're essentially saying, and maybe I can come back with this aspect of, availability versus acceptability. I think, there is an advantage in not just promoting the child or promoting, the person here, but promoting the unit, like if the system is stronger, then essentially most likely each and every individual part of that system will also be reinforced. And this is speaking to the importance of really promoting the importance of family, and families under all of its colors and shapes and definitions, right? But this notion of, strong family units. And this brings us back to this idea of accessibility and availability. So I guess, we might have some time later to mention a few key resources. Nathalie came to us through the Quebec Alliance of Perinatal Mental Health, but there's certainly, for example, very good colleague of mine, Marie-Claude Dufour, who leads the réseau des CRP, which is des centres de ressources périnatales du Québec, which they have amazing resources. More recently, we contributed to le livre blanc de la périnatalité, which is essentially it's filled with evidence-based research, but it's written in lay terms to be accessible to all, and it contains a plethora of resources for parents. So I think for me, that's the thing. I think we really have to promote support of mothers, definitely postnatally, but also what are we doing to support families as well?
Maybe I'm going to oversimplify the next steps for this, but I remember leaving the hospital and I had this very heavy book about what's gonna I forget what it's called, 0 to 5 or
Mieux vivre avec
Mieux
ton
vivre.
enfant.
Oui, exact. So it was, and it was a really heavy book,
Yes.
but I don't remember them talking about everything that we just talked about. Isn't there space for another one of these huge books, or just a pamphlet with some of this information to get us started and towards positive changes? And I guess my question's to both of you, but Nathalie, would that have made, because I'm thinking about myself as well, just knowing about the resources that we just heard from, that Dr. Montreuil talked about, just knowing that, I don't know, just resources is a good start, right, Nathalie?
It's a good point. And the first time I heard about depression, postpartum depression, was at Tout le monde en parle a few years ago, way before I was even thinking about having children. It was from Jessica Barker. She pointed out that in that book, at that time, there was half a page. And remember that the book is like this page.
Yeah.
So there was it's a huge, but the page are really are half a real page. There was half a page about depression, but I don't know how many page about how to latch or to. So, and it was proving how there was a lack of information or in prevention. I didn't look at mine a few years after we have more page, but of course I read it, and like I said, it didn't really prepare me that what's going to be the symptom, when should I consult, who should I talk to. So yes, there are space, it's not completely, I don't think it's silly to think that we could use the tools we have right now, just like this book, or maybe the appointment I had personally with the doctors or nurses, just to ask me, are you doing okay? So I think there are some tools right now.
Yeah.
What's blocking? I don't know. Maybe
there's space, right?
There are. I think there are. So.
Yeah, well, just to answer your question about Jessica Parker, who's a great person that we is a great supporter of this cause, and I think she's definitely carried this this mission at a Quebec level, if not more Canada wide. But essentially, yes, we did the exercise. There's about, like, now I think currently about maybe a page, if let's say a page and a half. So certainly there's room for improvement when we consider the 400 other pages in there. Because I think what people need to understand is, like, this idea that, maybe I have, let's say, 25 pages about, how to bathe the baby, how to wrap the baby. But if mentally I'm not doing well, if psychologically I'm depleted, it doesn't matter if I have all this information. I can't consolidate it. I can't read through it. I don't have the volition to actually carry it out. And I've had a number of people, like via research or even in my office as a clinician, tell us this. So the idea is that, this sort of like the mind over mood. We have these principles in psychology by Podesky and Greenberger that are saying that, in order to have, for example, the impression that we can do something, that we're doing well, like it needs to be sort of like preceded by, like a certain mindset. And then, we need to be able to carry out those actions. And then through those actions, we get reinforced. But certainly there's room for improvement. And I think on that, what I would want to say, and there was one thing that it was actually informed by Nathalie. We had this conversation because I guess for me as a clinical psychologist that's trained to implement interventions that are using a sort of cognitive behavioral therapy framework, we use a lot of psychoeducation. We were talking earlier in this podcast about normalization and, mental health literacy. And there was something I remember sitting there in that kind of like virtual meeting when Nathalie meeting her on the first time, and she said something. I hope it's okay if I paraphrase you, Nathalie, because for me it was a game changer. It opened my eyes to an important limitation that we have, and that is, she said something along the lines that mental health literacy in the absence of actual resources and means. So strategies or tools is actually has a perverse effect, to which I had to ask her, can you just explain to me? And so to use your words, Nathalie, was like, basically, like, after a while, when you keep on hearing that it's normal and that others feel this way, it comes a time, and probably you could best explain it, Nathalie, but it comes to a time where you're like, okay, well, it's been a while and I'm still not doing well, but I'm told that things is normal and things should technically improve. So if I'm not improving, like, what's wrong with me? But in effect, like, you're not being provided with tools. And so as a clinician, a psychologist, not a physician, like in a framework that I work and I operate in, we use literacy, we use mental health and normalization. But that's just to create the alliance, create that space to make the person feel secure and to say, what, like, take down your guards, like, there's nothing wrong with you. This is very normal. But that's just to kind of create that connection. And quickly, as psychologists, as mental health experts, we go into, okay, here's what you can do. There's more passive approach, for example, like mindfulness and relaxation. And then there's more sort of active things that you can do, such as, like, for example, cognitive restructuring, more mindfulness based and acceptance and tolerating distress. So we provide tools. And it made me reflect that a lot of the times in a lot of our campaigns, we just kind of like are okay with doing a lot of mental health literacy, which is good. But then what comes next? And this is what we're talking about now. Where are my tools? Where are they available? And how come I have to become sick to actually get those resources when in effect they were available, before I got ill, but I just could not access them. So obviously mental health literacy is critical, but it's not sufficient to really provide the help that suffering and, sort of like motivated parents need in a critical time, which is like early infancy.
Yeah.
And I would add that even if it's accessible, like in that book, you're saying that there may be one page, a page and a half, but there's still more information out to bathe. In my mind, and probably in everybody's mind, if there's that information on bathing and that information on health, it gives me the idea of the risk of baiting is much higher
it's more
than
important.
the risk of hell.
Yeah.
It's more important, or the risk of happening will be higher in baiting than in mental health. So of course you're not lead to ask yourself or to get into action of, I'm not doing okay, and you're being told it's normal. You're not led to do some action.
Right.
And then you just go on. I could tell you there was someone saying that 2 first years are the toughest. So I was and I was not well. So I was secretly hoping that if I hold on those 2 years, and at the second birth of my girl, it would all suddenly disappearing. It's completely silly, but I wasn't that mind saying, okay, those 2 years.
You're waiting for it. But Nathalie, thank you for saying that, because that's a question I was going to ask as well. I'm sure that there are parents listening to this saying, okay, so if I'm noticing a difference or a lack of motivation or something is off, and I know something is off, do I just let it pass? Is it a moment that's going to pass, right? Like, am I going to get through it with time passing? And what I'm hearing from you, Nathalie, and from what I understood with Dr. Montreuil, is we need to take action.
Well, it will pass, but don't just do nothing. Just don't expect that it'll go away by itself. Just as anything else in the world, if you're hurt, you will if you catch yourself, you'll get better, but you'll probably put a plaster or something. So yes, talk about it. Don't worry about it. Yes, it'll pass. It passed for me.
Yeah.
But take some actions. Look at ask yourself, what could you do for yourself, for your mental health? Talk to your partner, talk to your friends, your family, but don't just do nothing. It won't go away by itself.
And if people tell you that it's normal, or a doctor perhaps dismisses it and says, like, it's part of the phase, maybe we have to be a little bit more proactive in that sense of pushing to get support and help.
Yes, to go to action. So yes, it's normal. Don't feel that you're the weak person, you're the weak mother, or you're a bad mother or a bad father. So that part of normalization, I think it helped me at first, saying, okay, I'm living a normal phase. But what I'm saying, that normal phase shouldn't lead to don't do nothing. Do something to get better.
I'm really happy you brought up that word. The weakness, right? Because I've heard this we spoke with Dr. DaCosta, who's also a Montreal, a McGill professor, and she was talking about dads and how they felt, they didn't go through all of that, and they shouldn't have symptoms, postpartum depression or anxiety, or feel like this is difficult. And they felt like it was showing weakness, right? And a mom might feel that as well. Like, I need to be able to do it all. And if I can't, or I feel sad, or I feel overwhelmed, like that means I'm not good enough at what I'm doing, or I am showing signs of weakness. That is such an important word for us to say, because I know it'll help parents feel seen, because it's not a weakness to experience this.
No.
And I would even argue, like, for a lot of parents, I would say, like, I often tell parents, and we have this intervention that we're doing, obviously not perinatally at the moment, but, one of them is it's called parenting with confidence. And one of the things that, you'd be surprised just by telling parents, like, yes, it's normal, but also telling them, listen, the fact that you're questioning your ability as a parent, the fact that you're struggling in and of itself, just frame it differently. It's evidence that you are a good parent because you're caring. That's driven by the fact that you're so concerned about, the care that you wish your child to have, that essentially it's causing you distress. So when we're going back to the weak, let's reappraise this weakness as, like, I'm just concerned. I just actually care. I don't know how, but because I care, I'm going to, my child is worth it. I'm worth it. I am a good parent. And you know what? I will seek help. So I think, one of the things and we see just the fact that we're just changing the labels. We haven't done much yet, but we're just basically like telling parents that, that in and of itself is evidence that you're a good parent. And most parents out there, even if you're not doing exactly what might be best for your child or what you would want to do for your child, a lot of it is just because, we're bombarded with so much information that we're not quite sure. But I would tell you that most parents that I've met are parents that actually are good parents. Intentfully, there are good parents. There's just, either too much information. How do I know? Or there's for some people, now we're talking about Nathalie, you're fortunate enough to have a family support, like friends, and you're well educated, and you're someone that is resourceful, and all those are individual, what we call social determinants of well-being and health. For some people in certain demographics, and new arrivants that arrive to Canada, which are more socially isolated, maybe that their social economical status is lower, maybe they're even, we've done a study with CHHSN, which is, a community conglomerate or services that offer support to, non-French speaking Quebecers, so English speaking Quebecers in the province. Essentially, even language is something that basically also interferes with your access to care. So essentially, I think, there's if Nathalie had difficulty with who she is, accessing resources, it's clear that for other communities or individuals or demographics in the province and across Canada, access to the timely resources is an issue. So when you were saying, yes, things do get better, but unfortunately, I can tell you, working with, for example, the Canadian Perinatal Mental Health Collaborative, that for some women, the outcome is not a favorable one. And so we can't just, just sit on the fact that they're going to find resources. Like, what are we doing proactively, like you said, Cindy, to actually make those resources like at their disposal? If you allow me to just add as well, like when we're, immediate postpartum, what's the protocol of care? Like we basically have the parents test. We check to make sure that the car seat is not expired. We make sure that parents know how to buckle the children adequately in the car seat. We also talk about the shaken baby syndrome protocol.
Yes.
And I'm thinking to myself, like, what precedes that? If you want the parent to be calm and be able to feel competent to put that baby in their car seat, if you want the parent to be we talk about emotion regulation, if we want the parents to be regulated and be able to have the emotional space to deal with a crying baby that is just not consolable, and not resort to shaking their child. It's all about mental health and psychological balance. So for me, I always question, I think those protocols are amazing, but it just makes sense to me, or rather, I'll say on the flip side, it makes little sense to me why we can't have that dialogue while we have the parents under the care, to basically empower them to feel better equipped, or at least know where to go for resources. You were talking about a pamphlet, Nathalie. So that speaks to that as well.
At the very least, right? That pamphlet, but we are there. They are with us. They are, we are at the hospital. And I do remember for all three kids, they went through that shaken baby syndrome and the protocol for that. What would be my action plan? And if and I'm glad that they did that, but it's not addressing why you would want to do that, and the emotion aspect of that, and the mental health aspect of that, which I experienced after my kids as well, and it wasn't the first. After the first, I know some parents that are listening, it's like, whew, nothing happened, I'm okay, I have my second now. But for me, it was after the second and the third where it just kept getting worse, because I ignored my mental health after my second and had a baby soon after. So it just kind of like amplified itself. And I do think that it's important that we keep talking about that. And for myself, even after I stopped nursing, I had nursed for a few years in a row because I had babies so close that when I stopped nursing, I went into a depression, not even understanding what was going on. And only when I started talking about it, people said, hey, I experienced that too. And I didn't even understand what had happened to me. So I do think that there's lots of space for it's not the literacy part, but it's more of the action plan. This might happen to you. You might feel this way. Yes, it's okay. But now what? Right? Like that's the part that's missing.
Exactly.
That's what we need to focus on. So I do think there's a lot of room for that.
Yes.
Yeah. I unfortunately have to end this conversation. I really don't want to.
No.
Both of you have been truly important for this conversation and have added such an amazing part of this dialogue. I do want to end this conversation on a positive note, perhaps for parents that are listening. What are the next steps? So, parents listening to this, perhaps they're expecting their first, they're waiting, perhaps they're expecting their second and have one at home, and they're starting to feel that something is off. Maybe we can start with you, Nathalie. Like, what advice do you have for this parent moving forward? And then we can follow that up with Dr. Montreuil in terms of like what is possible, or we're going to add a lot of resources to the show notes of this podcast. But, in terms of like what the next steps would be for that parent.
Well, like I said before, if you think you're experiencing anything, and even if you think you're not experiencing depression, think about yourself. Being a good mom, a good dad is also being good in health,
right.
Mentally and physically. So if you think you're experiencing anything, go talk, and try to see what's best for you,
right.
And the baby also. So if it's taking a day off, or I don't know, and it's good also for going back to work. When you go back to work, try to see with your manager and your team what's best for a good return to work.
Yeah.
Going back to work day one, as a professional, as the professional were before. Well, you might think it's really hard after 12 months of a mat leave.
Right.
So try to see and talk about what can be done so it's easier to get back to work, or to get into a life of a mom or dad.
Yeah.
Try to adapt, and try to adapt your baby, but try to adapt your life.
Yeah.
As a new mom, as a new dad, it's possible. There's no one size fits all.
Right.
So that's what I would say.
And I think I just want to add to that, like some parents will say like, my relationship has changed, or I'm struggling now with my relationship. So it's not necessarily that I'm feeling, symptoms of depression or anxiety, but I'm feeling overwhelmed. There's an emotion that's being amplified because of this new baby. I'm feeling overwhelmed with my relationship. We're struggling with conflict resolution. All of that adds to our emotional and mental health, right? So I think it is that in terms of looking at our overall life, maybe even with a parent, like an in-law, something is happening. We have a new baby. Lots of parents and in-laws have advice for us sometimes. And that adds to the stress.
Yes.
Yeah.
Oh,
yes.
Yes.
And Dr. Montreuil, knowing, Nathalie, what she was saying, but what would you add to that from a clinical and a research perspective?
So 3 points. First point, what I would say is that essentially that taking care of yourself is caring for your baby and your child. So basically that is so important. It's not like it's not something selfish. It's the analogy. I've been talking about this, airline mask in case of emergency analogy since 2015. So that's not new for me. But it's become a bit more like sort of popular since post-COVID. But essentially this notion that we understand when we're on a flight that if we are to try to put on our child's mask, because that's what parents or even for our elders, we'd be inclined to helping the powerless, that essentially if we're going to be running out of oxygen, and here the oxygen parallel to psychological well-being is kind of emotion regulation, is like, being at an optimal mental health or psychological capacity. If I'm to run out of oxygen, well, I won't be able to actually help my child or whoever else is weaker or in a more powerless position than I. We get that. We would do it, right? So the same goes, like looking after your own well-being as a mom, as a new mom. It is not selfish. It's an act of love towards yourself. And we know that from like, for example, like a lot of, DBT, dialect therapy, behavioral therapy, it's like self-love is basically being able afterwards to care for others. You're caring for yourself because you're caring for your baby. So that's the first thing. The second thing I would say that goes with that is self-compassion. Parenting is messy. It's messy, but it's also beautiful because it's an opportunity to grow as an individual, right? You're learning about yourself through those interactions with that little child that is so small, but yet, brings about so many elements, where no one else would, we would never put up with any of that, if it wasn't our own, our own offspring, our own child, right? So use a lot of self-compassion. It's not going to be perfect. But you know what? There's beauty in, for example, the second time or the third time, right? And stop worrying about, having had one negative reaction, right? It's really sort of an additive thing. If it's more often negative than not, like Nathalie said, do seek help. But if once in a while, you slip, that's part of parenting. And we know it's like any other sport. If I told you I would win a marathon tomorrow when I've never, practiced for it, you'd say, Tina, that's ridiculous. Well, the same thing as parents. Like, this is all new to us, like no one's really trained us to do this job. And I would say, lastly, I would be hopeful because we're in an era now where we're talking more and more about it. And I really feel that in the next couple of years, a lot is going to happen in this space of perinatal and postpartum mental health in terms of parenting. Like, I'm involved with various projects at, the provincial level. There's going to be like some exciting things coming up in terms of resources. Decision makers are hearing, have heard. So I think if anything, there's been times in maybe like in the past couple years where things have been difficult. I really do feel that there's a lot of new things that are going to be arising or developing in this sphere of perinatal mental health and everything having to do with the transition to parenthood. Our minister, Ministre Carman, is very, very connected with the reality of parents. So it's very encouraging. So I would say, with all those three aspects, I think there's a lot to just be hopeful for, and let's build a community. That's the whole point about these community resources. Let's build a community. Let's access these community organizations that are there to provide support.
Right.
If you don't have a family.
Right, exactly. I will add all of those resources down in the show notes so people can click on it and get them, get the accessibility to them. Dr. Montreuil just mentioned self-compassion. I interviewed Dr. Kristen Neff. I'm going to add that to the show notes as well. Her work is pivotal around that. So I just want to say thank you to both of you. This conversation was amazing, and I have a feeling there'll be a follow-up at some point because it is an important one. So thank you to both of you again.
Thank you so much, Cindy, for the opportunity. And Nathalie, thank you so much.
Yes.
You're wonderful.